In my particular case, my grandfather had some horrible occurrence. They gave it to my father. My father was in World War II, where in his squadron of 10,000, 100 made it home. So that DNA went to me. Then living with him was an adventure every day, walking on eggshells. So he gave PTSD to my mother, who eventually took her life. And his behavior also gave me PTSD. So I had genetic and I had the environment, so I had both. So that's a very common path.
That's so powerful and clear how you were able to parse those out and unpack those for us. And I think being able to think about how that's passed through secondary, soon to be PTSI, and also the epigenetic path that things come to us through our genes is so fascinating. Welcome back to the Flourish or Fold Stories of Resilience podcast. Woo! Do we have a treat for you today? We have Dr. Eugene Lipov here with us, and we are going to be talking about all things related to trauma. Now, Dr. Eugene Lipov is the Chief Medical Officer at Stella, and he is one of the foremost international experts on how we experience, and perhaps more importantly, how we heal trauma in our lives. Welcome, Dr. Eugene.
Thanks so much for having me.
I am delighted you are here. So I have just been totally blown away by your experience. You and I meeting was a sort of fortuitous introduction made by a mutual friend and colleague who's also been a guest on the show, Chase Bell, who's a beautiful singer and songwriter. And I've been thinking in my mind for some time that I was really interested in what are sort of the medical treatments that are available for people that have experienced trauma. I've experienced significant trauma. You've had trauma yourself. We'll talk about some of your experiences later in the show. But why don't we start out by just learning a little bit more about how you have really dedicated your life to the treatment of trauma, and what did you do as the Chief Medical Officer at Stella?
So, well, the reason I'm interested in trauma is because I've seen a lot of it, and we'll talk about some of my experiences. But unfortunately, current therapeutics, which are available for trauma or PTSD, the term I'd like to change to PTSI, by the way, which we'll talk about that hopefully, is that unfortunately they're lacking. So the current therapeutics of gold standards, such as psychotherapy and pharmaceuticals, efficacy rate is quite low. We're looking 30, 40, maybe 50%. So there was I think there's a huge need in it. So I've been very interested in that. However, I'm not a psychiatrist or a psychologist, so I've been very far from that field. So I'm a pain physician, just to give you a background. I'm an anesthesiologist and I'm also a pain physician. So through an interesting set of circumstances, I was trying to treat people with hot flashes, women with hot flashes. And I published on that. And I had people said, yes, it's working, but you have no idea how it works. And I had some interesting attacks on me in the press, which was interesting. Anyway, so that gave me a lot of encouragement, talking about being persistent, especially in your book, by the way, amazing book. You talk
Thank
about,
you so much.
Thank you. Persistence, when you have something to push against, you have something to work with. And I was trying to understand why it worked. So I read a lot of articles. One of them suggested that a procedure that I know how to do well, it's called stellar ganglion block, which is an injection in the neck, which affects fight and flight nerves, can reverse PTSD or stop the symptoms of PTSD in 10, 15 minutes. That led me to treating the first patient, publishing on that 2008. Since then, I think a number of people have been saved from suicide using that procedure, not just by me, but a lot of it has been done in the military, special forces, Civilian people have been treated. So it has been an absolute honor to see how that works. And so the whole principle is that it's possible to treat PTSD rapidly and effectively by resetting or rebooting the fight and flight system. So as a chief medical officer at Stella, my job is to perform those procedures as well as do research. One of our new efforts is we're looking at epigenetic change or aging that could potentially be reversed by doing procedures. So if you think of PTSD impact on aging, that's actually measurable, which is amazing, calling epigenetic clocks. So my partners in this is UCLA University. And then, but the whole concept that you reverse PTSD, you can live longer and healthier life, that's mind-boggling, I think. But that's a study I'm doing right now, actually.
Wow. And so what you are saying is that you have some preliminary evidence that would suggest that when we are able to reverse the experience of PTSD through a stellate ganglion block, that not only does that alleviate the symptoms of PTSD, that may actually lead to living a longer and healthier life.
That is my assumption. I'm basing an assumption on, I'm studying that right now. That's never been studied, but I have a real study I'm going. But there was at least one study that shows if you reverse PTSD symptoms, then you can live a longer, healthier life. The technique they use was different. Their success was 50%. So my assumption is, since our success rate is 75 to 85% in that range, we should be even more effective. That's my assumption.
Amazing. Amazing. Let's talk for a moment about people who are listening who have experienced trauma, who have a loved one, who have a family member who's experienced trauma. How do we know, Dr. Eugene, if we've experienced trauma and we've been traumatized?
Well, I think the body tells you. You just, when I always tell people, especially people when I train, you have to listen. If you listen, it's pretty amazing what you know. So a lot of people with PTSD or PTSI, I'm going to continue using the term PTSD because people are familiar with that. People with PTSD a lot of times have a feeling of doom, that something bad is going to happen. So if you listen to that, the body is trying to tell you something. What I found recently, it's kind of interesting. So a lot of times when I do the procedure, which resets sympathetic system, the feeling of doom goes away in 10 minutes. People go, I don't feel this doom anymore, which is like, I've been hearing it for years, but I was like, yeah, it's interesting, but I don't know what to do with that. So I was doing some research. Turns out there is a condition called pheochromocytoma, which is a tumor of the adrenal gland. It produces norepinephrine, which is the same thing as fight and flight system. So the number 3 symptom of that condition is feeling of doom. So a biological tumor can give you feeling of doom. That interesting?
Mm-hmm.
So the
That's
point is,
fascinating.
if you have a feeling of doom, if you have a feeling of hypervigilance, you're looking around, you cannot be comfortable. If your sleep is off and you're easily triggered, like a lot of people I treat go, before I've treated you, I could go from 0 to 1,000 in about a microsecond like that. And people get hit, all type of bad things happen. After the procedure, people go, yeah, I go from 0 to 20. I have a control of my response. So if you have this high impulsivity, that's a problem.
Mm.
So those are signs of.
I love that. And so for people who experience trauma as children or as young adults before we get to the age of 18, right? And I'm, one of those people, and a lot of our listeners know my story of having a stalker when I was in high school who came to the house multiple times, ended up attempting to break into the house, and ultimately after I went to college, attacked and brutally raped a woman in our neighborhood. So I was diagnosed with trauma, right? based on what the DSM-5, the Diagnostic Statistical Manual, says. And one of the things I think for me and for so many people who experience trauma early on as children is it's so difficult to sort of parse out like what is the trauma and like who am I and what's part of my personality. So there could be people out there who just think, I've never slept well. I've always had a short temper. I've always felt like something bad is going to happen. And what you're saying is, that these are actually real symptoms of trauma and something that you and your team can actually treat.
In a word, yes. It's really simple. So the thing is, it's kind of interesting. So the question of normality, what is normal? What is it normal for me to be a complete SOB? But the question to me is that, do you have to being normal to you doesn't mean you have to stay like that. I'll give you an example of a patient that we treated, and you tell me what you think about it. So we took care of a gentleman who was, in Vietnam as an 18-year-old man. So his job was to put wounded on the helicopters and evacuate them. When I met him, he was about 60 or 65, something like that. And he was one of the biggest SOBs based on his reports of his commanders. He was a very difficult person to deal with. He's gone through 10 wives, a very difficult individual. So we did the block, and he was like, so his commander called me up. So what do you do to him? What's wrong? I mean, he's like normal, nice, pleasant guy. What happened? So the point is, if you think about fight and flight system, it doesn't care what happened to you. It's trying to keep you alive, but it's not always relevant. So to me, if you listen to your body and you feel that, and then the question is, if let's say my trauma happened at 2 or 3 years old, I don't really have exact data to say this is going to work like this or it won't work like that. But it doesn't, the length of trauma or the types of trauma don't seem to make any difference. The response seems to be similar and the whole reason I think it works like that is because fight and flight system is all pervasive. It's everywhere.
Mm-hmm. Mm-hmm. And there's a lot of people out there, I think, who, how do we want to say this? They've had something difficult, happen, and, but they think, other people go through worse things, right? We're seeing so many atrocities on the news, and they think, well, this wasn't so bad, or I shouldn't be upset or traumatized, or they don't necessarily feel entitled to give themselves the label of having experienced a trauma. What do you say about that, Dr. Eugene? What's sort of the threshold for understanding if we've had an experience that you would categorize or we get to categorize as being something meaningful and traumatic?
Well, meaningful and traumatic is two different things, right? As you point out in your book, you can learn a lot about yourself, about trauma. But as far as that's a very common question people ask me, because I treat people who are special forces, which is pretty clear. People go military, of course, there's PTSD. But then equally, I took care of a gentleman who was walking at, I think, 16 years old through school, and somebody touched him on the shoulder and he got startled. He got PTSD. It depends on three things. Number one, genetics. It turns out you can inherit PTSD or potential for PTSD. The people have I've heard the great expression saying that nature loads the gun, but the experience fires it. Meaning, if let's say your grandfather was in some kind of war and then your father went through whatever, your chance of dealing with PTSD is much higher compared to somebody who had very simple, they didn't have those experiences. So that's one. So it depends how sensitive you are to the trauma. And then I don't think anybody is in any position to sit. In fact, I was giving a presentation in military museum, and this grizzled veteran asked me, he said, well, I think military trauma is very different than other type of trauma. So my answer is, are you saying your experience is worse than a woman that was beaten and raped? I don't think that anybody can make that decision. In fact, I did a study and published in 2022 looking at 22 different types of trauma, and they were all responsive to my procedure. So that means to me is that if you have the symptoms that I described, that's good enough. The point is, you know something is wrong. If you want to do a more formal assessment of yourself, you can do it at home. Put in PCL-5. You can print it out, do your own scoring. If you're above 33, you probably have PTSD. You don't have to go anywhere. You can do it privacy of your own home. It's all symptoms. And in fact, the people who can help you make a diagnosis is usually your loved ones or significant others. They'll say you shouldn't be jumping out of your skin. In fact, I interviewed a gentleman. I was in the podcast, and a man, and then he came back to my podcast, and then he was saying, "I don't have PTSD," and his back literally was stuck in the wall. He was military, and he was like looking around. I said, "Can you sit like in a restaurant with your back not to the wall?" He said, "I can, but I'm extremely uncomfortable." That's one of those subtle signs that you have PTSD, because you're always plank, literally, and you're hypervigilant. When you're hypervigilant, you can't sleep, and if you have a feeling of doom, that's the diagnosis. I don't know if
And could that feeling of doom be related to anything? Could it be related to someone, someone thinks that someone they love is going to be in a car accident or get hurt or be killed in some way, or concerns about finances and financial solvency? I mean, does that feeling of doom show up in a lot of areas in our lives, or is it sort of a general feeling of doom?
it's, in my particular case, it was just, there's always going to be stress in a modern life. There's always tension, stress, that something bad could happen. But if you think about somebody, you know people who are like, nothing seems to get to them. They walk around, it's like, oh, everything is good, no problems. Like, okay, you may fail exam. Okay, then I'll bounce back from it. And that's where resilience walks in, right? I think respect for yourself is a huge part of it. That, obviously terrible things can and do happen, but 90% what happens with it is how you deal with that. But as far as, I'm not saying those are not realistic worries, but there is worries, and there is, you feel doom that it's going to happen. When, I often hear, especially from women, because women have a tendency of minimizing their feelings because they were taught by our society to do so, I think. And then, I shouldn't be feeling like that, right? So you're judging yourself. I shouldn't feel X. Everything is fine. I have great kids. I have this. I'm healthy. My husband is loving. We have money. We have a great home. I feel like something bad is going to happen. But obviously, if you watch the news 24/7 and you get all the alarms and you see atrocities, you have to be protecting yourself a little bit, at least. It will make a difference if you've seen the same news segment 20 times or one time. To me, it doesn't. It's information, not entertainment.
Yeah. So I want to go back to the treatment of trauma, because I think this is so important for people to understand that there are options. Because I think in sort of the mainstream world of treatment and therapy, many people are not aware of the opportunity to have this procedure, to do its stellate ganglion block, and to be able to essentially, alleviate, many, if not all of their trauma symptoms. So could you walk us through, what is the stellate ganglion block, and what is that experience like? If someone wanted to pursue this as a treatment for themselves or their family members, what are the next steps, and what's that experience like?
Sure. So, well, the great thing, that's why I and a very smart, wealthy individual set up this organization. It's called Stella Center. So we have the entire system set up. So the first thing, people gets assessed, right? In medicine, you want to have diagnosis first, not treatment first. So they get assessed, make sure they're the right candidate for us. if they're not too sick and mentally they're stable. And then they come in if everything is all set. We put an IV in for safety. About 2/3 of my patients want to go to sleep. Like when I had mine done, I was asleep. I did not want to be awake for this. It's not painful, but you just feel a little numbing. So we numb up 2 spots. In fact, the new version of SGB is called DSR, dual sympathetic reset. If you have time, I can tell you how that came about, but we do 2 levels instead of 1. It seemed to be more effective. So again, many people sleep through, not everybody, doesn't really matter. And then I use ultrasound guidance to find the right spot to see where everything is at. So I can see where the blood vessels are, bones are, and the targets are. And then I use a special, it's called echogenic needle I can see under ultrasound to get in the right spot. I put local anesthetic in there, and I do it in 2 levels. Takes me about 5-7 minutes. And then patients go to recovery room. They develop something called Horner syndrome, which is a droopy eyeball and red eye. That's part of the effect. We know we hit the right spot. And some people, that's all they need. A lot of people need psychotherapy following that. What we find that a lot of people, instead of doing 2, 3, 4, 5, 10 years of psychotherapy, now they can do much more in a couple of months because they didn't get triggered. They can participate in it. And the big part is we highly recommend aftercare, such as psychotherapy. In fact, Stella can provide that. Or if they have their own therapist, of course, it's better to stay with them. We also recommend yoga and meditation and attention to your diet, like high sugar drinks, huge amount of coffee is a bad idea. And then you can also reduce some medications, and that's basically the method. I can get more injection-wise. I'm an injectionist.
Yeah. And so how long is that procedure? And then how long does that block typically last?
So the procedure is about 5-10 minutes. Under 10 minutes, somebody who knows what they're doing. Keep in mind, we have 40 associates across United States. We have 1 in Israel and 4 in Australia. So it's not just me doing it. Flagship is in Chicago, but other people are doing it. As far as lengths of effect, longest outlier we know about is 17 years. And then he had 2 injections 17 years ago. We had a couple of people that I'm aware of that have been over 10 years from 1 procedure. But it depends on what you do. It depends on your genetics. It depends on aftercare. Do you do psychotherapy? Did you change your life? Are you trying to avoiding like terrible things? And it depends what happens to you. We took care of a Chicago police man. He was doing great for a year, and then he had to shoot somebody in line of duty, and that flipped him back. So we had to treat him. Because, there's no, I want to cure PTSD. If something happens, you need to be able to respond to it. You can't just kill everything in your body. You need to be interactive.
Mm-hmm. Mm-hmm. Yeah, I love that. I want to read a little bit from your book. You wrote this incredible book, The Invisible Machine, which I absolutely love. The startling truth about trauma and the scientific breakthrough that can transform your life. I'm going to say that again. The startling truth about trauma and the scientific breakthrough that can transform your life. It's a tongue twister, I guess. So much incredible information in here. And one of the things that I was really struck by in chapter 7, just the first part called the crisis. And I think this really speaks to this sort of pervasive level of trauma that we have inside of our, kind of collective human community. And so you write here, as individuals, we now spend hours each week at doctor's visits and picking up prescriptions. Some of us spend that time picking up a bottle at the liquor store or turning to another vice. We desperately want our sickness, our pain, our anxiety, our restlessness, our sadness to go away. Many do not want to feel at all. But what if we could get to the root of what is causing this malaise? What if we could get to the root of the illnesses that are keeping us from work and family? Isn't that powerful?
That is a true statement. In fact, when people talk about alcoholism, that it's a condition, to me, you're just taking your troubles for a swim. You're just trying to be relaxed for a second. You're trying to find hope for a second. Just a little break in this whole barrage of stimulation. So if you can do that long term, you don't need to drink or smoke or cocaine or whatever else.
Now, one of the missions that you're on that I'm so excited about and behind 100% is actually changing the name of how we talk about trauma. So many people are familiar with PTSD or post-traumatic stress disorder, and you are on a mission to change the name of PTSD. Tell us more about that journey that you're on, what you want to change the name to, and why you feel this is of pivotal importance.
Thank you. That is my mission. That's true. So we even have an official pin. It's PTSD. It. So the way I started the journey is I was introduced to an amazing man, Frank Ackberg. So he is a psychiatrist who came up with the term Stockholm Syndrome. So in 2012, he and General Peter Shirelli, who was a 4-star general for the Army, Peter's job was to prevent or avoid suicides with the U.S. Army. And both he and Frank went to APA, American Psychiatric Association. That's who defines terms in DSM. And they said, if we can change the name PTSD to PTSI, post-traumatic stress injury, the implication is that there is a biological change in the brain that you can actually see using advanced scanners, which happens to be the case. Then a lot of people save their lives. APA said no. So this was in 2012. So Frank is getting
and
old.
Sorry to interrupt, for our listeners, can you, I think not everyone knows what APA is, if you want to give us a little bit of a background on that.
I'm sorry about it. So DSM-5, you were talking about Diagnostic Statistical Manual, is a book that's put out by American Psychiatric Association. So APA. So they're the ones who define the term. So if you want to change any name in psychiatry, in US and actually globally, you need to submit your request to the APA. So it's been like that since the beginning, to 1952. So the names in an APA are and DSM are flexible. So DSM-1, which was, I believe, was 1952, homosexuality was considered mental disorder. That was not well received. So in DSM-2, it was changed. In DSM-4 to DSM-5, they changed a few names, such as learning disability. The APA committee felt that there was stigma attached to that, and they felt that needs to be changed. There was also sexual misassignment disorder. There was a few names that were changed because of stigma. So what I did with that information is I did the survey based on 3,000 people. Basically, what they said, the findings is that if the names change PTSD to PTSI, the stigma will improve, so stigmatization will improve, and which is exactly what Peter Shirelli, the 4-star journal, and Frank Ackberg has been saying for a few years now. And there's a number of articles that shows if stigma is improved, people will survive or live much better lives because they get care. Because if you're stigmatized, then you're not going to go see anybody for any help. And a lot of times end up in a very bad place. So to that, we start the movement. In fact, I also start the podcast. If you look at this, and I have PTSD and PTSI, not PTSD. Right. So So I published on that. I also presented that at the American Psychiatric Association this year. In order to change the name, you need to do science work. You need to send an official request to the APA saying, please change the name. Because now, since this is 2023, they have a rotating option. You can actually change it anytime you want to, if they choose to do it. So I send it in. And what's interesting, when you submit it, there's one specific question that they ask. The name can be changed if you can demonstrate the current name produces harm. To me, it's very clear it produces harm, basically, on my finding. And it's intuitively makes sense because patients, if you think, in fact, you look at our website, it's itsptsi.com. You can see our public service announcement. It likens PTSD to a broken leg. If you have a broken leg, there's no argument, right? So your broken leg, put a cast on, thank you very much, because you have an x-ray to show it. You don't say, hey, keep running on that leg, see what happens. You know what's going to happen, nothing good. So if you have a brain scan, like functional MRI or PET scan, so you have PTSD, go get treated. No argument. I think the acceptance will improve, and especially with all the horror that's going on in the world, I think we need to start thinking about PTSI very soon, because the amount of suicides and depression and early death, like for example, PTSD or PTSI is associated with twice the likelihood chance of heart attacks. So mind has a significant impact on the body, and vice versa. They both work together.
It's so fascinating. You know, one of the things that's coming through, I think, so strongly in this conversation is the mind-body connection and how often and how easy it is for us to really separate those, you know, but you talked about the adrenal tumor and that, you know, that additional secretion of norepinephrine actually creates that impending sense of doom. So here's a physical manifestation of a tumor that's actually creating a psychological experience for us, and the interconnectivity of our mind and body, I think, is just always so fascinating.
I agree. One big ask I have is what I'm trying to do. We're doing a letter writing campaign. So if people can go to itsptsi.com, and if they can fill out a letter there, and the idea is I want to save those letters and aggregate them and send them to the APA, the head of the DSM committee. Because I think when you have like physical boxes of letters, I think it'd be very meaningful. That's what they did. The same thing was done during DSM-1 about homosexuality. There was letter writing campaign, demonstrations. I'm not suggesting demonstrations, but I think letters would be really useful because I did the sciencey part, but I think if there's a social awareness, the name should be changed. I don't think there's many people who will argue that it's the right thing to do.
Beautiful. So we're going to go ahead and put that link in our show notes to invite our listeners to submit a letter and to talk about this name change and really moving from, you know, the D, the disorder, to an I for PTSI. There it is, for injury, to effectively reduce stigma and to give us an opportunity to access mental health in a way that we would with our physical health, to not have to feel bad if there's been an injury, and to allow people to cross that threshold of getting help so that we can reduce suicide, we can reduce mental health concerns, we can allow people to be able to function at their highest level and to not feel bad about the way that trauma has impacted their lives. So I think this is incredibly powerful. We'll include that link as part of the letter writing campaign. And I love this mission and journey that you're on. Now, we're coming toward the close of our time. And, you know, one of the things that we talk about here on our podcast is this idea of hidden challenges that so many well-known people like you, Dr. Eugene, have experienced difficulties, challenges, changes, and complexities in their lives. And I'm interested to know for you, are there experiences in your life that you feel like have really brought you on this path and given you such a heart to be at the epicenter of treating trauma for so many?
Yeah, actually, there are two specific ones. So the first one, I was a medical student, third year medical student, and I was snorkeling in Mexico. I was hit by a propeller blade. I lost half my blood volume. I had an out of body experience, and the man who hit me was drunk, and he was watching me bleed in the ocean. So I crawled myself out of the ocean, put pressure on the bleeding points because I had medical training by that point, and I survived because of that. So what's interesting, the biology of that, to me, there is a term called hormesis. It's a term that was coined in longevity literature. What doesn't kill you makes you stronger. Like in your book, by the way, amazing book.
Thank you.
You talk about not bouncing back by bouncing forward. So
That's
if you
right.
look at the biology of that, what happens, which is crazy, is that you have a genetic change that activates other genes that makes you much stronger, more resilient, which is, I think it's fascinating, at least to me. And then that was the first experience. So a year and a half later, my mother took her life when I was a surgical resident. So both of those experiences, and I had a number of other ones, but those are two main ones. I think it made me, my mother's death made me much more interested in psychiatric issues and the need for better treatment. And that's, I've been persisting. I think being hit by a propeller blade had really made me much more hardier than an average individual. So my brother calls me BB, brother bulldog. That my path on it. And you talk in your book about how do you know when to persist? Are you stubborn or you persist in the right path? And that is a fascinating question. That was a terminology originally developed in Greece, as far as I know. And that is a fine line. You can persist, but in the wrong area, that's not very helpful at all. So to me, the way I make judgments, if this could potentially help a lot of people, then I'm the right path. If it's up in the process a little, yeah, I'm pretty hardy. I've been through a lot. So that's how I make it. If it's trivial, then why do it?
I'm taking all of that in. I know you've had years to take those experiences and since they've happened for you, I think one of the things that's coming up for me is are there elements of those experiences, or let me say it differently. How do elements of those experiences live with you today? These are things, we never get over, right? We don't get over loss. We don't stop missing people. And yet we're able to make sense of things over time. There's a healing path that we get to engage with. You had these incredible traumatic experiences happen for you, and how do they live with you today? How have you been able to integrate them or alchemize them to some extent, or have you been able to do that?
I have. I'm happy to say I have been able to come to terms with them. In fact, it's interesting. So the mind. So when I talk to my patients, I always tell them the brain is a car. You're driving it, or it's going to drive you off the road. So I believe I can drive my brain, in the sense that the experiences. So the way they live with me is twofold. One, most of the time, it made me very comfortable that whatever I'm going to be dropped into, I'm going to make it out of it.
Mm.
So that gives me confidence in that space. Before I was hit by a propeller blade, I was very introverted and shy. Not really a problem for me at this point. And I wanted to become a lecturer, and I started lecturing. And beginning was not that particularly easy. Having an accent, I spoke too fast, my slides were bad, but I became a pretty good lecturer, and I've lectured on 4 continents so far. So that's not bad. But as far as like my mother's death, every time I help somebody, I feel like she's smiling down on me and saying, "Great job."
Mm.
So that's how I integrate. So to me, I think you can get beyond the experiences, you can learn from them. So people talk about post-trauma growth. I feel like I've had a garden grow.
Mm. You feel like you've had a garden grow.
Yes.
I'm so touched by that. I'm so touched by what you said. And I'm just imagining that moment each time you get to help someone, that you actually have this interaction, with your mother, where you see her smiling down on you and saying, good job.
And like, for example, last week I did 20 people. So multiplied by a significant number of people. I come to work no matter what time I have to get in, no matter how late I have to work. I have a smile on my face because I love helping people. Being a physician is kind of part of the gig, but it also gives me an emotional, it's very cathartic for me to be able to see people get better.
Mm.
Every time they don't get better, it makes me, when people watch movies or do whatever, I keep digging literature on a continuous basis, figuring out how to push the success rate further and further and further and further.
Mm.
Because
Yeah.
I like to be that person. And the other thing, I had my stellate ganglion block done. You can see it on YouTube. And I also had an amazing psychologist that worked with me, Dick Schwartz. I don't know if you know him, unbelievable man. So I do feel like we have come, all of me have come to terms. Build me, the current me, the last me, the future me. I like to live the moment. Not that I'm responsible, but I think a lot of times people try to, if you find yourself doing 5,000 things at once, it's a form of distraction. That's another way PTSD can show itself. Because we
Mm-hmm.
have like a number of special forces guys who take Adderall and things like that. They go, we don't need it. Now we're focused. Because they're not frenetic, now they're laser focused, which is much
Mm-hmm.
better for to have.
Yeah. Yeah. It's incredible. I want to just touch on one more thing here that you mentioned that I think is incredibly powerful. We began to unpack a little bit the inheritance of PTSD. And
Right.
I don't think everyone listening maybe knows what epigenetics is. So if you want to just kind of define epigenetics for us, you talked about one of the risk factors for developing PTSD, or PTSI, as we're going to call it going forward. Ta-da! Is having family members experience trauma. And I'd love to just hear a little bit more from you, because I know there's a lot of interest in inheritance and multi-generational transmission, and this idea of epigenetics, which you'll define for us, around how trauma is passed from one generation to another. And does that come biologically? Does that come through our nurturance? Both, how do we think about the transmission of trauma between generations?
Well, let's break it apart if you don't mind. So let's talk about epigenetics. So epigenetics actually is a new science. It's only 20, 25 years old. I have a degree in genetics from 1980 that did not exist at that time. So the usual way people in medicine or in genetics were taught is the only way to change DNA is have a mutation, which is a big process. So it turns out our body is much smarter than we are. And when something happens, you can turn on and off the genes. They're flexible. You can go on and on. And that change can get passed on 2 or 3 generations. So for example, the way it was designed, I think, by nature was that, let's say you're a caveman and you're surrounded by tigers. You're always in a heightened state of alert. Your DNA genes get turned on and you're hyper vigilant to survive. You want your offsprings to be able to be hyper vigilant to survive as well. And that's why it's there. But it can get stuck like that. That's why you can reverse. In fact, I wrote a paper, theoretic paper, that says you can actually flip that switch back to the pre-trauma state. So potentially may not pass that on. So that's genetic. Another term that people are starting to use more and more is called secondary PTSD, which is, I wrote a paper on that actually came out this year. Typically, the classic example, soldiers come home, they're aggressive toward their wives, and they give them PTSD. So when we treat military personnel now, what we try to do is treat the family unit, meaning you want to treat the guy and the woman, and a lot of times children, because they're all in the continuous loop. So if you treat the guy, but the woman still has PTSD, now he feels bad that there's PTSD because of, and it just continues cycle. So you can have genetic. So just in my particular case, my grandfather had some horrible occurrence. They gave it to my father. My father was in World War II, where in his squadron of 10,000, 100 made it home. So that DNA went to me. Then living with him was an adventure every day, walking on eggshells. So he gave PTSD to my mother, who eventually took her life. And his behavior also gave me PTSD. So I had genetic and I had the environment. So I had both. So that's a very common path.
That's so powerful and clear how you were able to parse those out and unpack those for us. And I think being able to think about how that's passed through secondary, soon to be PTSI, and also the epigenetic path that things come to us through our genes is so fascinating. Dr. Jean Lipov, this has been an incredible conversation. I am so uplifted and inspired by the work that you're doing, by the people that you're helping each and every day. I know that our listeners are going to hear this and they're going to share it with their friends and their family members and people that they know that have had trauma and say, look, there's something out there. There's hope. There's another opportunity. There's something you can try. You've made this available to the public and to the masses for people who want to learn more about you, more about your incredible book, The Invisible Machine, the work that you're doing. Where can people find you, connect with you, get more information? And we'll put all these links in our show notes too, of course.
Thank you. So Stella Center is an organization that I'm a chief medical officer. So if you want to be treated, you just need to contact Stella Center and our nurse practitioners will talk to you and see if you're an appropriate candidate. So that's the first step. Either I can do it or my associates can do it in different places. If you want to get more sciencey stuff like DNA changes or my publications, if you want to go to dreugenelipov.com, so drlipov.com, you can find the book there. It also is available, whatever books are sold, as they say, ta-da. And it's also audiobook exists. If you would like to sign the letter, there is a dreugenelipov.com also has a link, PTSI. The other thing, if you would like to wear this attractive pin and be part of the group, then you can certainly buy the pin there, and proceeds of that will go to Erase PTSD Now, who is our not-for-profit kind of sister organization that helps us treat people who cannot afford them. So, and we're going to be having a fundraiser coming up November 17th. So if you look up that, it'll be simulcast somehow or other on, I think, YouTube. And the last thing is, Chase and I released a song today. It's PTSI. So it's going to be on TikTok.
Amazing. Amazing. We'll make sure we get the link for that. I am so excited. You are certainly hitting people across multiple channels. You've got books, you've got music, you've got you've got the Stella Center, you've got your not-for-profit, and of course you've got your own podcast, where people can connect with you as well, and also write letters to be a part of this campaign to eliminate and eradicate the stigma that's associated with trauma so that people can feel great about getting help, just as they would for a cancer diagnosis or for a broken leg. Dr. Eugene Lipov, this has been such an amazing conversation. I am delighted and honored that you've joined us on our Flourish or Fold podcast today, and I hope you have a wonderful day ahead.
You too, and I hope everybody flourishes. I love that name.
I love it too. Let's all flourish.
Exactly. Thank you.
Flourish or Fold listeners, thank you so much for tuning into this interview with Dr. Eugene Lipov. This is such a tremendously important episode because what Dr. Lipov has uncovered is an ability to treat trauma outside of traditional therapy, which often or many times doesn't always work for trauma, for post-traumatic stress experiences, whether or not your trauma meets the diagnostic criteria of being traumatic, your trauma is meaningful. Check out the Stella Center in Chicago. Dr. Lipov is doing incredible injections, which quiets our nervous system and allows us to be able to experience life with reduced trauma responses or even free of trauma responses. He is saving lives. He is working with people who are military service members who have been deeply traumatized. He's working with people that have been traumatized as civilians. You obviously don't have to be in the military to experience trauma. And his work is groundbreaking. He's saving lives. He is keeping people from committing suicide by reducing their trauma symptoms and making life feel livable again. And of course, I hope that you will look more into his work and sign his petition to change the name of post-traumatic stress disorder, I'm doing air quotes, to post-traumatic stress injury. Let's together all reduce the stigma that there is something wrong with us if we've experienced trauma and we've had a normal physiological response. Many of you know that I am a survivor of what is today called post-traumatic stress disorder. I had a stalker in high school and developed symptoms of PTSD, met the diagnostic criteria for 2 decades, hid it for a long time from people because I thought there was something wrong with me. I bought into that stigma, hook, line, and sinker. So let's together reduce the stigma of trauma. Let's support ourselves and our family members and our friends and our loved ones to get treatment for that trauma. And let's change the name to be injury instead of disorder, to know that when our body responds to something traumatic, there's not something wrong with us. It's that we're simply having a normal physiological response. So thanks for being here, Flourish or Fold listeners. As always, please share this episode with people near and dear to you, your friends, your colleagues, your neighbors. I'm so grateful for the continuing expansion of listeners that we have here. And I'm just delighted to be your host. Until next time, it's Dr. Taryn Marie. Hey there, Flourish or Fold listeners. As a mental health professional and someone who cares deeply about our overall health and wellness, what I know for sure is that our mental health doesn't just stop below our neck. Mental health is about feeling not only great in our minds, it's also about feeling great in our bodies. Now, I'm sure that you've seen a lot of information about new weight loss drugs, injectable weight loss drugs that are either on back order, completely inaccessible, or if you have access to them, so expensive that the vast majority of American people cannot get a hold of them. Well, I made it my mission to find a way for everyone to have access to these medications in a way that is affordable, because I see how life-changing they are for so many people. Now, I've spent months vetting companies, and I'm excited to announce that I believe I have found the very best. I've partnered with bodycaremd.com because they offer the highest grade weight loss medications. These are called GLP-1s. I have been to their FDA registered facility, and I've watched them make this product myself with my own eyes. Body Care MD provides the absolute best weight loss medications. And if you want to get to the weight that you have desperately struggled to get to for years with diet and exercise and simply nothing works, there's no shame in wanting to feel better, to have more energy, to have more confidence in the way that you look. You're going to go to the website, and I've got a code for you to get 20% off. It's Dr. Taryn, Taryn, Taryn 20. You'll get 20% off your first month. You will answer some questions online, and you'll be connected with a network of licensed doctors in all 50 states who will carefully review your medical records and ensure that you're a good candidate. So check out Body Care MD, enter the code Dr. Taryn 20 and receive 20% off your first order. Here's to having access to these medications that have been in short supply, and of course, having the opportunity to have the body, the energy, and the health that you've always dreamed of.